Let's talk about incontinence. So incontinence is a fairly common disorder that affects a lot of women in particular, more women than men. And it does cause some significant problems, particularly with social isolation with women, because due to the incontinence and the difficulty of controlling or knowing when it's going to happen, they don't want to go out and socialize with their friends or their peers. And it's really one of those problems that people don't talk about and don't bring it up even at their doctor's appointments. And that is the area where I would hope that people would bring it up a little bit more often, because there are a lot of therapies that can be helpful, but it's not a one-size-fits-all therapy option. So when you think about incontinence, when I think about it, I think about there being several different types. So the first type that I think people are most familiar with is what we call stress incontinence. So stress incontinence is where you cough, laugh, sneeze, and you have a little bit of leaking that happens. Now sometimes people have this when they have a very full bladder, and otherwise they don't have any issues with it. But other women will have it where they empty their bladder and then they're going to go do an exercise routine, and even though they just emptied their bladder, they still have leaking, and so they have to wear the black jogging pants and all of those things to try and help camouflage and cover it up. So that's the stress incontinence. And stress incontinence, one of the things that is notable for it is that it is generally caused by a weakness of the pelvic floor muscles. So when we're thinking about pelvic floor muscles, one of the best ways that we can help that is to do two things. One, strengthen those pelvic floor muscles, and two, work on losing any extra weight that might be pushing on those pelvic floor muscles. Now, of course, you and I both understand that losing that extra weight is not an easy task. And when you're struggling with incontinence and leaking, you don't necessarily want to exercise because that causes more leaking. But the studies have shown that if you can lose some of that extra weight, even 5%, so if somebody weighs 200 pounds, if they're going to lose 5% of that, that's 10 pounds, that can even start to make an improvement in their incontinence. So that's a tidbit of stress incontinence. Now I mentioned there's more than that though. There's also something called urge incontinence. And urge incontinence was made a little bit more familiar to people by this commercial that came out probably about 10 years ago. And the commercial had a cute little jingle to it. It was the gotta go right now. Well, that was a commercial for an incontinence treatment. That's a medication. And that particular medication helps women who have specifically urge incontinence. So what urge incontinence is it's literally a bladder spasm, because the bladder is a muscle. So it's a spasm of the bladder that squeezes the bladder and causes a little bit of urine to come out even when your body is not ready for it. Now, our bladders usually contract and squeeze urine out, but it's only when we're in the bathroom when it's supposed to happen. In this case, it's kind of like that Charlie horse that you get in your leg at night. It's that really severe cramp that comes out of nowhere, and it just causes the urine to come out. Now, similar to the stress incontinence, there's multiple different ways to treat it. And some women will find that there's certain things that make their urge incontinence worse. And I hate to say this because everybody hates it when I bring this up, but caffeine is one of the biggest contributors to the urge incontinence. So people that are drinking regular coffee and say they may have 2 or 3 cups, and by the way, their cups are not the 6-ounce cups, their cups are the 12 to 20-ounce cups. They're venti size, and that exacerbates or increases that problem with the urge incontinence. So one of the things that we talk about is lifestyle and how can we change it to try and help make that better. Now, a third type of incontinence is what we call mixed incontinence. And mixed incontinence is a combination of those first two, the stress incontinence as well as the urge incontinence. And it is certainly possible to have both of them. When I'm talking to a patient about them, usually what I ask the patient is, which of those two is the worst? Which one is causing you the biggest issue? Because that's the one that we're going to focus on first. It doesn't mean that the other one stops existing. It just means we're going to try and make your life better with one of them first, because to treat them both is more difficult. So we try and treat the one that's causing the biggest issue, and maybe the other one will get better because of the treatments. For instance, either the weight loss or physical therapy, those types of things. But either way, we try and separate them out because there are different treatments for each. And then the fourth type of incontinence that I want to bring up, because it's one that's even less talked about, is fecal incontinence. And fecal incontinence is where you have some smearing of stool or maybe even a full bowel movement that you don't have good control over. And many times that's coming from other issues. Sometimes it's GI issues, sometimes it's lactose intolerance, and it really upsets their stomach, and so then they have a problem. But sometimes it's just that the nerves that are helping to control the bowel are not firing correctly. And again, there's treatments for that. But I would say that those 4 types of incontinence are the types of incontinence that are not talked about enough, and there are treatments for. And where I would encourage you to start is with your primary care provider, bringing it up to them, because the primary care providers have great experience with this as well, but if they don't know that it's happening, it's harder for them to help you. And so bringing it up to your provider first is the first step, and then there's all kinds of options after that first step that we can try and help you with. So that is a brief summary of incontinence.